Some viral infections knock some people down hard, just like COVID did to many of us. Millions of these patients could never recover. They became housebound and bedbound with severe energy limitations and abnormal response to exertion, mostly accompanied with orthostatic intolerance and many other symptoms. The World Health Organization has classified myalgic encephalomyelitis, ME, as biological since 1969. Standard imaging and blood checks fail to diagnose ME, and there is no approved treatment for it, making the need for research dire. 4 out of 5 patients are women. Against the common belief, exercising makes a patient's situation worse. With its own traits, it became an outlier disease, not fitting to the convictions of an average doctor. 80% of the doctors see ME as a psychological disease. Yet many of the patients were healthy and fit before the infection, and many of the patients have demonstrable biomedical problems as a consequence. An average professor of psychology came forward to feed the hunger of Dr. Joe and open the gates of psychologizing. He conducted a bogus trial. In his research, he pictured ME as a mental disease, and he concluded that it was curable with mental treatment and exercising. This research became the reference point of authorities. This way, a biomedical disease had been hijacked by an elite group of psychologists. They renamed it as chronic fatigue syndrome, and the patients were left to live in the shadows. And the trial. The data was flawed, and the conclusion would make the insurance companies simply happy. Once the disease was labeled psychological, the patients were swept under the rug. Fellow patients were systemically gaslighted, stripped of their benefits, dignity, and healthcare in the therapy rooms by the average psychologists. They were harmed further in the hands of the medical experts under the name of treatment. While the scientific evidence of the persistent and long-term effects of viruses is only growing, creating alternative science and opting for psychological treatment could only be not even wrong. Unfortunately, negligence prevailed over the facts. Tragically, patients were committed to psych wards. Children were separated from their caring families, and lives have been lost due to alleged medical negligence stemming from this refusal to accept the seriousness of ME. Unfortunately, we are too sick to take the streets.